It's 5:30 and the meeting is hereby called to order. Okay, sorry about that. Just a minute. Okay, so fellow Rotarians, we'll begin our meeting with the Rotary prayer song. PPLE, please, do you have that in handy to play for us by way of?
Yes, Rotary President.
Thank you very much. So when Rotary President PPLE finishes since we are doing this to partnership with our friends from the Lions Club, once we're done with the Rotary prayer song we'll switch on also to the Lions prayer song. So PPLE, can we proceed? Thank you. Thank you very much, PPLE. Lion Gifty Nkrumah, can you please help us with the Lions prayer song?
Okay, thank you very much. Lions, we serve.
We serve.
Please, can you help me start this meeting with the Lions prayer? When
they attend the Lions Club
and break bread at the table,
I give a million thanks to God
to know that I am able
to meet there with my fellow men.
Relax and sing.
Hear the singers of the day. The fine songs
they bring.
I realize
that I am part
in caring for the blind.
Also the underprivileged.
Also underprivileged. Let's keep
Now
them
as we
all
do
in mind.
our daily task.
Now as we do
our daily tasks,
pray
God
to give them
Liberty and intelligence
will be our nation's safety.
Lions,
we serve.
Thank you very much.
Thank you very much, Lion Gifty. And sorry about the other interruptions from persons who aren't supposed to be speaking. We had other microphones open. Sorry about that. Okay. RP Vic, are you there? RP Miniskirt. As referred to by CP. RP Vic, are you there? Kindly unmute. PPL, can you help her unmute?
Okay, John President, still looking for her now.
No, she's here with us, but her microphone is on mute.
Okay. I'm sure she can unmute herself, but maybe she's not attending to her. So
RP Vic from Accra, can you please unmute yourself and then? Okay. Maybe we may have to proceed. Okay, so fellow Rotarians, Lions and retractors and guests, please help me recite the 4-way test of the things we think, say, or do as Rotarians. So one is, is it the truth? Two is it fair to all
Fair to all
Concerned.
concerned.
Three
Build goodwill and better friendship.
For friendships
Will it
Four
be
is-
beneficial to all
to
concerned?
all concerned.
Thank you very much, fellow Rotarians, retractors, Lions and guests. Please, those of us who have bottles, glasses, water, wine, whatever we have, whatever liquid you have before us, please join me in drink a toast to the Republic of Ghana.
The Republic,
Republic of Ghana.
Cheers. Yes, cheers. So for introductions, let me, since it's a joint meeting hosted by Accra-Spintex, let me invite, first of all, we'll start with the Magenta Women's Lions Club. Can you please, if the president is here, can you please introduce your members to us?
Okay. Good evening, Lions.
We serve.
We serve.
Yeah, I'm Lion Mami Erba, president of the Magenta Women. And then I think I will let my people introduce themselves. I'm seeing Lion Letitia. So can he, okay, let me just go ahead and introduce them. We have Lion Letitia, the Magenta Women. We have Lion Gifty. Lion Letitia is a service chair. Lion Gifty, first vice. Lion Alberta Boche, she's our CP. We have Lion Patient Secretary. We have, please, if I don't mention your name and then you are here, can you please prompt me, and then, or you can introduce yourself as well. Because so far, the people that I'm seeing is Lion Letitia, Lion Gifty, Lion Nana Boatema, she's our director. Then Lion, our Garden Lion who has joined, Lion Dr. Helena Samoa Hassan, she's our Garden Lion. She's also on call. Lion Enu is also on call. I think so far, these are the Magenta Women Lions ladies who has joined. So if you are here and then you didn't hear your name, you can please unmute yourself and then introduce yourself. Thank you.
Thank you.
Thank you very much. So, of course, so since we have a lot of us Rotarians, retractors here, for the sake of Rotary time, I mean, we skip the rest of the introduction for Rotarians and then proceed with the rest of the program. So, Rotarian Father, are you with us? Rotarian Father, Accra, Tishinungwa.
I am RP Albert.
Thank you very much. So, Rotarian Father, kindly introduce to us our speaker for today.
Okay, thank you, RP. Fellow Rotarians, Retractors, Interact, Lions, and guests on the call. Dr. Kwesi Amissah-Arthur is a Rotarian with the Dynamic Rotary Club of Accra East. He is a senior clinical lecturer and consultant vitreoretinal surgeon at the University of Ghana Medical School. He trained in the United Kingdom together with his colleagues, Dr. Brimer, modernized surgical retina service at Kolebu. He has co-authored over 20 scientific papers and has a couple of book chapters to his name. Dr. Kwesi holds several international grants for research, including a Google DeepMind Artificial Intelligence Research Grant. He is married to Mame, and together they have 2 daughters. Fellow Rotarians, Retractors, Interacts, Lions, and guests, let's warmly welcome our speaker for this evening, Dr. Kwesi. You are warmly welcome, sir. Thank you, RP.
Thank you very much, Return Vida. So, Dr. Return, you have the floor.
Thank you very much, RP Albert. Thank you very much, Rotarian by RP Vida, for that introduction. I would also like to thank PP Shika for inviting me to come and talk. So our topic today is going to be how not to be blinded by diabetes. And for those of you who have a short attention span, the next slide is all you have to remember. So if we could advance to the next slide, please. All right, everything we do in life, okay? The more we procrastinate, the more we make it harder for ourselves, okay? Everything in life, the more we procrastinate, the more we make it harder for ourselves. If we feel we should save money, but we think we'll wait till tomorrow, we make life harder for ourselves. If we think we should lose weight, but we say we'll wait till tomorrow, we make life harder for ourselves. If we think we should start building a house, but we say we'll wait till tomorrow, we make life harder for ourselves. So the general takeaway today is try not to procrastinate. Okay. The next slide. Please, can we advance to the next slide? The next slide is for those of you who want a little bit more detail, okay? So the first slide was the easy one. The next one is basically to prevent yourself from being blinded by diabetes. You essentially have to look after your general health well. You don't have to wait till things are late. You don't have to eat the wrong foods and do the wrong things. You have to look after your general health well. And by looking after your general health well, for most of us, we will prevent ourselves from getting diabetes. Unfortunately, some of us, even despite doing that, we will get diabetes because of genetics, because of our family, because of things outside of our control, okay? And if you do get diabetes, then you manage it well. And that is the final thing I want to remember. So at this point, anyone who wants to sleep, anyone who wants to go away, anybody who wants to go and drink some wine, you're free to do that because the rest is just the detail. And this is the main take-home message. Okay. So if we move on to the next slide, please. So every time I give these talks, at the end, I get like a thing saying, oh, what made you choose the eye? And I have to answer it. So now what I've done is I just start with saying that, you know, when I was young, I used to tell women that I love gazing into their eyes because their eyes are pretty. But one of the reasons why I really like the eye is that seeing truly is believing, okay? And you don't need to be a doctor to see that, oh, I think we've gone too fast. Can we go back up? Yeah, you need to be a doctor to, yeah, we can stay here. And then we can go to the next one with the gray eye. So you see the Ghana flag eye. And you don't need to be a doctor now to tell that this eye here, there is a problem. You don't need to be a doctor to be able to say that this person cannot see. And that is one of the things that interested me about the eye and about ophthalmology, in that almost every time when our patients or our clients come to us, they know exactly what is wrong with them. They come telling us that, doctor, I cannot see, doctor, me, who are you? So it makes it very, very easy in our profession. Unlike some people where you're telling people they have hypertension and they don't believe you, etc. All our patients know exactly what is wrong with them when they come to see us. Okay, next slide, please. The part of the eye that I am interested in is a part called the retina, and we'll come into that. But I like showing this because even without any training, we can tell that the picture on the right is the abnormal picture by all the red dots and the yellow dots that you can see scattered around there. And I'll explain this further later on. The next question I get is, how about those who cannot see? What does it feel like or look like to be blind? And invariably, everybody thinks that it is like this. Everybody thinks that you don't see anything at all. But there are multiple ways of being blind or being visually impaired. We prefer to use the term visually impaired. So if we go to the next one, please. So if you look at these pictures of these penguins, all right, some people might have a slight visual impairment where maybe there is a little bit of detail missing, like in the middle. Others might have it where there's a little bit more detail missing, and others might have it where they can kind of see a little bit, but not so much, as you see in the last picture at the bottom, okay? And this is typically caused by diseases that affect the center of the eye. And practically what that means is that when it starts, you struggle to read, you struggle to look at maps, you struggle to look at things with any precise detail. Then we also have the next type, which is where people have problems with what we call their field of vision. So they cannot see things around them. Okay, so blindness or visual impairment can form multiple different ways. And one of the problems is that it also depends on what you do, what job you do, what your hobbies are, etc., as to how badly this affects you. Now, the thing about blindness, if we go to the next slide, is that it is actually extremely troubling for everybody. And there's this study that was done by the American Foundation for the Blind. Can we move on, please? Yeah, and this study that was done by the American Foundation for the Blind asked people what they would rather have, okay? And interestingly, a lot of people thought that severe vision loss was one of the worst things that they could ever have. Interestingly, a lot of people would rather have cancer, would rather be paralyzed. Some people would even rather have HIV or AIDS, a large percentage, than be blind, okay? So blindness and vision loss is something that really, really troubles people, okay? Next slide, please. In our job, we meet people who cannot see, and sometimes we can do something and we have to act quickly or we have to operate, and sometimes we cannot do anything. So the Serenity Prayer is one of those things that we hold dear to our hearts because it's not everything that we can handle. And when it comes to blindness from diabetes, it's one of the challenges we have in that a lot of the time, by the time people come, it's too late for us to do anything. Okay. Next slide, please. For those of you that don't know much about diabetes, when we think about diabetes, a lot of the time we are thinking essentially about high sugar. But the main problem with diabetes is that it affects all the blood vessels everywhere in the body. So everywhere there is a blood vessel can be affected. And for me, the part that I'm interested in is the eye, obviously. And even inside the eye, I'm interested in something called the retina. And I'll explain that in the next slide. So the retina is analogous to the film in a camera. If you have an eye and you look at the inner lining of the eye, kind of like you open your mouth and there's a lining inside your mouth, okay? In the lining of your mouth, the retina is like that. Only that the retina is extremely specialized and it converts light into a signal for the brain to see. So you know the old-fashioned cameras that had film in them, and you basically go and develop the film and you get your photographs. The retina is kind of like the film. It accepts all the light so that we can see. Okay, next slide, please. The problem we have, most of us, is that we love to procrastinate. We love to do things that are simple in order to get a big advantage. So this cartoon is one of the ones I like to use, where this morbidly obese person is stuffing their face full of things they probably shouldn't be stuffing their face with and correcting it by a bucket load of insulin next to them, okay? And I think that procrastination is one of the biggest problems we have. When we move to the next slide, yeah, thank you. We are looking at the retina. So that lining that I was talking about inside the eye, it's got blood vessels. It's got this yellow thing there at the edge. It's called the optic disc or the nerve. And that takes all the information to your brain to enable you to see. This is a normal retina, okay? So this is how everybody's retina should look. Now the next one, yeah. So in this retina, we see all these yellow things sitting there, and we see some black, some red things there as well. These yellow things are all fats and oils inside the retina, okay? And these fats and oils have seeped, please go back one sec. These fats and oils have seeped into the retina because of the diabetes. So you're literally leaking fluid into your eye. Okay, we can have the next one. And in this one, we are starting to see a lot more bleeding, a lot more red, and some abnormal blood vessels growing. The problem about the abnormal blood vessels that grow, exactly, is that they can break. And when they break, they bleed in the eye. And you get all this blood just sitting inside the eye. And blood in the eye is very toxic to the retina. So you don't want this to happen. Okay, next slide, please. Once the blood goes, you're left with what we call scar tissue. Just like if you get a cut on your skin, you get a scar inside your eye too. If there's bleeding, you get a scar. And the problem is that the more scarring you get, the more harder it is to treat and the more likely you are to go blind from your diabetes. Okay, next slide, please. So we have the option of treating if people come early with medical lasers. We have the option of giving injections into the eye. And yes, we do inject into people's eyes, all sorts of medicines to try and prevent the diabetes from getting worse. Okay, next slide, please. I always tell people it's better to prevent diabetes. And if you get it, it's better to manage it with drops or your diabetic medicines or whatever than to have to come and meet me in theater. Next slide, please. The problem about coming to theater is that by the time you come to theater, the damage is so severe that almost anything we do, we are trying to catch up. Most of the time, what we're trying to do is to allow you to be able to walk independently. We're not doing it for you to read. We're not doing it for you to watch TV. We're doing it just so that you can get up and go to the toilet on your own. That is how low the bar is. In Ghana, we have about 210,000 blind people. Of those, they are blind in that they cannot see at all. We have 300,000 that have severe visual impairment, and of those, 100,000 are reversible. That's mainly from things like cataracts. 50,000 are blind from glaucoma, and 30,000 are blind from diabetes. Now, the diabetes statistics has consistently been increasing. Okay, so some years ago, we were quoting this number 27,000, but now we're quoting 30,000. Now, the problem is that there are only about, this number has gone up a little, there are only about 90 trained ophthalmologists in the country to deal with this tsunami of problems coming up. And in the next slide, you'll see that all the evidence is showing us that sub-Saharan Africa is going to have the highest increase in diabetes and diabetes-related complications of anywhere in the world. So we have an even bigger problem coming up. In the next slide, we'll see that in Africa, it's thought that we're going to have 110% increase in people living with diabetes, okay? Already we're getting 30,000 blinded, and then now we're having 110% increase year on year. So that number is going to go up. And the reason for this is because many years ago, there were hardly any fast food joints. There was hardly any pizza. A lot of people walked more than took public transport or drove. We live a lot more sedentary lifestyle. Our eating habits have changed. We're eating more processed foods. So we're getting more and more of what doctors call type 2 diabetes, which is diabetes that you get later on in life. I think that above everything, we should remember that a sound mind lives in a sound body. And the same saying goes for a sound eye lives in a sound body. If we can continue to look after our general health well, try our best not to get diabetes, and if God forbid we get diabetes, we manage it well, then we shall all live long and healthy lives with no eye problems. Okay. I'd like to thank you all for giving us the opportunity to come and talk. I'll dedicate this to PP Amissah, who was laid to rest yesterday. May his soul rest in peace. Thank you.
Thank you so much, Rotarian Dr. Amissah. Fellow Rotarians, retractors, Lions, it's time for questions and answers. There are some of us who don't want to wear glasses at all, so we will be more concerned. Those of us wearing it already, of course, we want to stop wearing it, so we also have our questions to ask. So fellow Rotarians, guests, retractors, Lions, over to us, questions, and then Doctor will help us with some answers. Thank you very much. So you raise your virtual hand and then, okay, CP Shikara.
Yes, RP, thank you very much. And thank you very much, Dr. Rotarian and Kwesi Amissah-Arthur, for this short but very interesting and enlightening presentation. My question is that, are there any specific tests that one can do when you go to the hospital to know whether you're diabetic or not? Because at times, I'll take myself as an example. Sometimes I'm not well and I go to the hospital and they're asking me, oh, are you diabetic? Have you done any diabetes tests? And I said, well, I don't know what tests that there are to do. So are there any specific tests that one has to do to find out if they are diabetic or not? Thank you very much.
Thank you very much. So there is a test you can do. It's called the fasting blood sugar test. And generally, if you don't have any symptoms and you don't have any problems, you don't need to. But after a certain age now, the thinking is that everybody has to do yearly labs, or every 2 years they do their normal labs, and that should be one of the things that is done. That is the new vogue. So we are moving more towards preventative medicine than rather waiting for problems to come and then deal with it. So there are 2 tests. The first one is called the fasting blood sugar, which you take when you fasted. And the second one is called the HbA1c, or glycated hemoglobin. So those tests can tell you whether you have diabetes or not. The fasting blood sugar can also even tell you whether you are you are close to having diabetes, what we call peri-diabetic. Yeah.
Thank you very much.
Madam President, if in case you are speaking, you are muted. But
so my network dropped. So Derek, kindly introduce yourself. We have just as Derek. So if you are a Rotarian retractor or Lion or guest, kindly introduce yourself and ask your question.
Okay. Good evening. This is Lion Derek from Time Industrial. Yeah. During the presentation, he did mention of it being something you can inherit from a parent. Assuming your grandparents are non-diabetic and for a non-healthy lifestyle, your parents develop one, is it likely for you to develop one, knowing that before your parents there was none in, but due to the lifestyle of your parents, if they've actually been diagnosed diabetic? What are the chances for me as the daughter?
Yeah, it's a good question. So what we call the inheritance pattern of diabetes is not straightforward. Like with sickle cell, if your father has an S and you have an S, we can say, what percentage that you are going to get, because diabetes is not only genetic but environmental. Okay, so what most people have is a tendency to develop diabetes, but it doesn't mean you will. Okay, what it means is that if you look after yourself well, live healthy, then you reduce that tendency. There are some children who are born with diabetes, what we call type 1 diabetics, or people who are born with diabetes. Now that one, and I'm presuming that you're old enough that if you had that, you would know by now. So that one you would know within, by the time they're teenagers, you would know whether they have that or not. So we'll put that one aside. So we're talking about the other type where you can't develop it because your parents or your grandparents are at risk. But it's not so straightforward to say whether it will happen or it won't happen. It's a tendency. Yeah. I hope that helps.
Yes, thank you very much.
Thank you very much, Doc. So Rotarian Ketia from RC Accra-Spintex, you have the floor.
Thank you, Rotarian President. I would like to ask Doctor, he mentioned a certain age that we should be able to start checking whether even we have symptoms or not. So if you could confirm that. Thank you.
Yeah, so I mean, nowadays the modern thinking is that everybody over the age of 40 should be more proactive about their healthcare. Okay, so once you cross 40, then at least every 2 years you need to go for your general labs and your general checkup just to make sure that everything is okay. That is the current new thinking. However, having said that, if you're already very healthy and doing all the right things, you may not necessarily have to follow that regime. Absolutely, it's a good habit, but it's not a necessity.
Thank you, Doc. Ziggy, are you there?
Yes, RP, I'm here, please.
Yes, Ziggy. Yes, you are not asking. The way you've been taking off your glasses and putting it back on haphazardly. Please ask. I know you have an issue. Please ask.
Oh, no, I'm okay. I followed.
Oh, okay. So you stop doing that thing. You stop switching your glasses anyhow.
Yeah, I'm
Okay.
switching glasses. I'm okay.
Okay. IPP Dr. Papaji, you have a question for a doctor. So doctors will speak to doctors. IPP Dr. Papaji.
Thank you very much, RP. Thank you also, doctor, for this very very short. You started with this statement of procrastinating. And some of us, when we hear that word, our hearts jump because we are like kissiness. I would like to know the linkage with this eye thing, with the eye problem. And secondly, actually, for the information of people on the call, anytime we hold these health exercises, that is actually Accra-Spintex, there is a quick test of the diabetics inside. One was held last week with the Temawide team. So normally, I think anytime we do this health thing, it happens. So, Doc, the linkage with the procrastinating thing and then the eye problem or eye solution. And secondly, I wear glasses. Thirdly, I wear glasses. RP mentioned that those of them who wear, how can they lay the glasses down? Is it something possible, reversible, someone who is using glasses to be able to put that thing away? Thank you very much for this short, keeping the essential details, but eliciting the key facts. Thank you.
Thank you, IPP. So procrastination is honestly the bane of my life. It is, invariably when someone comes to me with an eye problem, like really bad diabetes, and I speak to them, it is almost clear that they knew several months before, sometimes years before, that something was happening. But either they said ebeyeye or famanyame or one of our normal terms that we use, and then also sometimes when you speak to people, you realize that they have had symptoms of diabetes. They've noticed they're urinating a lot. Sometimes they even tell you they urinate outside, ants go to where they've urinated. So when I talk about procrastination, I am talking generally about a behavior that is very rampant and common amongst most of us. I am preaching, but I am also to blame myself sometimes. And I feel that I don't know why it is, why we don't like to tackle things head on and tackle things quickly, but I think it is one of the greatest problems we have. And that is why I always bring that up every time I do one of these talks, because I'm hoping that maybe there's somebody in the room who started getting some blurred vision and thinks it to be okay, or there's somebody who's urinating a lot and thinks it to be okay, or there's somebody who has diabetes but is not going for any checkups, is not doing anything about it, and that hopefully this will spur them on to have some action, which is why I always bring the procrastination up. In terms of the glasses, for us, if you wear glasses and with your glasses, your eyesight is perfect, 6/6 or 20/20, we do not see that as a problem. Okay, so for us, wearing glasses is not a problem. Having said that, there are various laser treatments that can be done to reduce people's dependency on glasses and to stop people from wearing glasses. There are also things like contact lenses that people can use to stop wearing glasses. So there's a place called Interstar Laser and Eye Surgical Center in Accra that does the laser treatment for people who don't want to wear glasses anymore. I personally don't do that surgery because most of the time I'm working on the retina, the back of the eye. And for that, this surgery where you can stop wearing glasses is more towards the front of the eye. But it is possible to become independent of glasses. So for those of you who want to stop, I'll give you some free advice. Interstar Eye Clinic in Osu, they can help you with that.
Thank you very much, Doc. Doc, you're wearing glasses yourself.
Yes.
Don't you want to stop wearing it?
So the day I stop operating, the next day I'm going to go and have the laser eye surgery. So for me, the problem is risk-benefit analysis. It's extremely safe. It's extremely safe. But if God forbid I have even a 1 in 10,000 chance of something not being quite correct, I need really good vision to be able to operate. So for me, it's that analysis. That's why I haven't done it yet.
Thank you, Doc. So Solomonechi says, yes, great presentation, very concise and insightful, but he says it is scary. Is there any other way to make it not be that scary?
My aim is to scare people so people stop procrastinating. My aim is to make people aware because we've tried the gentle and it's not working.
Okay. PPL, you have a question.
Yes, thank you very much, Mr. President. Doc, please, I want to know, number one, if any of your parents have had diabetes before, does that mean you should take better care of yourself than someone else whose parents haven't had it? That's number one. Number two, what has club beer, which we all enjoy, got to do with sugar levels and diabetes? Thank you.
Thank you very much. So, I mean, when you have a parent or a relative who has diabetes, you should see it as one extra risk factor. Okay, and that's what I keep telling people, that it's not one thing that will make you get diabetes, it's multiple things. So when you notice that, look, both parents have diabetes, then you're like, okay, look, I have to really look after myself well. I have to cut my sugars, I have to cut my carbohydrates, I need to exercise, I need to do other things to reduce my chances of getting diabetes. And then maybe you're the type of person who goes for a check every 2 years just to make sure that everything is okay. Definitely, if both parents have diabetes, I would be slightly more concerned. Not worried, just slightly more concerned. Okay. With regards to the club beer has a lot of hops and malt and things in it, which is why we love it. But once again, too much of a good thing can be a bad thing. And obviously, the quantity of carbohydrates in beer, if you drink a large amount, can be quite high and can affect your sugar levels.
Thank you. Thanks so much, Doc. So, Doc, now the Kote is asking, is there a way doctors and health professionals intensify education? Please unmute. Please mute yourself if you're not speaking. Right. So Doc, Nadia is asking, is there a way doctors and health professionals intensify education on diabetes, retinopathy, especially in the consulting rooms?
Yeah, so I mean, this is very true. This is one of the things that we've realized that we're not doing as well as we should. And we've started a lot of work on this. You'll find that we do World Sight Day on Diabetes Week, we talk, Diabetes Day, we talk. When you come to the clinics now, we do some education outside before you come into the main Kolebu clinic. We're trying our best to intensify all of this. I think what we need is we probably need extra manpower in terms of counselors, etc., to help us to deliver the message better. The other thing we are doing is that now we are going to the diabetes centers and we're going to the physicians to also try and intensify the education there so that when people are first diagnosed, they get better. Having said all of that, there is a lot more we can do, and we are working hard at it. And it's one of the things that I think that maybe as a service project, we can look at something along extra education, not just for eye stuff, but for extra medical education and how to deliver that to more people. Thank you.
Thank you so much, Doc. So yeah, one more trouble for you. Attendees are asking, they want to have your number. I don't know how, whether you want to put it out there or there's going to be any other way for them to reach out to you. But some people are asking for your number.
I'll send my number.
Okay, so Doc is going to share his number with us. So thank you all so much. It's 10 minutes past 6, retreat time.
I've been more questions.
Oh, sorry. So, Doctor has shared his number in the chat box. So, fellow Rotarians, you can pick it up from there. We have our AG online, AG Kofi. AG Kofi, please go ahead with your question.
Thank you, RP. Good evening, everyone. Dr. Kwesi, thanks for the presentation. Quick questions from me, please. One, I want to find out, I know today's topic is highlighting the risk diabetes poses for the eye, but I just want to find out if high blood pressure and probably high cholesterol levels can also pose a danger to the eye. And then secondly, since you're advising that we should do regular checks, it could be annually or biannually, would you recommend that we also have our eyes checked on an annual basis and to sort of try to avoid the risks that you are seeing and dealing with on a daily basis? Thank you.
Thank you very much, my AG. Good to have you on here. So we recommend, I'll take the second question first. We recommend that everybody at least every 2 years has a general screening eye test where you basically just close one eye and read the chart and then close the other eye and read the chart, and then also have your eye pressures checked. Those are the two key things. Because if you read the chart and you can't read to the bottom, then we know there's a problem, then we can investigate further. So we generally recommend, once again, that over the age of 40, every 2 years, people should go and get their eyes checked and get their eye pressures checked. The reason we are very keen on the eye pressures is that glaucoma is relatively common in Ghana. And unfortunately, glaucoma, you cannot reverse it at all. So the earlier it's picked up, the better, okay? With regards to high blood pressure and cholesterol, they can definitely cause eye problems. There is almost no disease, that does not cause eye problems. And that's one of the interesting things about the eye, in that sometimes we will look in the eye and we will call our colleague physicians and tell them that this person is showing signs of blood pressure, but they say they don't have blood pressure. We think you should monitor them closely. Or this person has high cholesterol in their blood. Because we can see the cholesterol crystals in the eye. So yes, definitely, they all also contribute towards eye problems.
Thank you so much, Doc. So fellow Terrence, AG Kofi is the AG of Accra-Spintex, and is also a member in the same club with Doc. So yes, CP Shiga.
Yes, thank you, RP. Mine is just on the issue of Doc indicated that these days, we have a lot of the sedentary life and our diet is not the best. Is there a way we can get either dietitians or medical professionals advising us on what we should eat and what we should not eat? And many a times, my issue is that sometimes when I visit a dietitian, they give me, meal plans that are European meal plans, the food stuff that I can't even get here. So is it possible that, we can either it could be a project that Lions and Rotarians we could do, sensitizing people on the local things that we should eat.
Have you been able to connect with my phone?
Whoever that is, please mute your mic.
Please mute your mic if you're not speaking.
Yeah, so Doc, my question simply is that are there any local dishes that we can concentrate on, which will help us lower our sugar level instead of the pizzas, the KFCs, and all the other junk food? Thank you.
Yeah. So, I think I can get a dietitian to maybe come and do a talk one of the days. Generally, the thinking is that our local food prepared well is actually very, very good, very, very healthy. A lot of things like ampesie, kontomire, a lot of our soups have a lot of vegetable in them. What I've heard the dietitians say is that when it comes to carbohydrates, our corn-based stuff, our yam-based stuff, a lot of the problem is the volume with which we eat. Okay, so technically we are not meant, if you make a fist, you're not meant to eat carbohydrates more than the fist, whether it's fufu, whether it's banku, whether it's kinky, you shouldn't eat more than your fist size in carbohydrates in a meal. Okay, so you can have 3 bowls of kinky, but breakfast, lunch, and dinner, rather than 3 bowls of kinky at a sitting. That is what the dietitians tend to tell me. I think that there are a couple of good dietitians that I've met who can make a meal plan with local dishes and be a lot more adaptable. I'll see if I can get one of them. Maybe we can have another joint meeting and get one of them to come and talk. We can plan that.
Thank you very much. That will be great. Thanks a lot. RP, are you listening to the size of food you're supposed to eat?
That's what I always take anyway. So thank you so much, Doctor. Now,
RP, remember the 4-way test, please.
We have 2 issues coming back to you, Dr. Kwesi. So the first, okay, the second one is this: you helping us get a dietitian coming to speak to us. The first one, which whistleblower blew to my ears earlier, is that we'll also be coming to you to speak to your spouse, so that she also comes to give us a presentation. So we have two things coming into your next request.
No problem. No problem.
Thank you so much. Okay, so let me fellow Rotarians, Lions, Retractors, Rotary Time. So okay, IPP Jonas, you raised your hand up a while ago, and then you dropped again. Do you want to ask something to that? You can answer our last question.
Yes, please. Thank you very much, RP. Sometimes some questions look like a mood, but they might be very, very important. I don't know. There is one question in the chat box, which you haven't raised for Doc. Can more sex help control diabetes? In fact, this is a question, it looks like moot, but we don't know. There could be some foundation. So can doctor address that?
Yeah. So I read that question and I thought about it, and it's interesting because I go to some of these conferences, and there'll be a session that is meant to be a little bit lateral, a little bit different, and they'll ask questions like this, and you'll have people debating about how much energy do people spend in sex, how many calories do people burn in sex, and the amount of calories they burn, is it enough to control for diabetes or not? So on that thought, I'll say I pass on the question.
Thank you so much, Doc.
But Doc, I didn't get the answer. You passed on the question, like, is it good or it is not good?
It depends on how energetic you are. It literally depends on how many calories you burn.
So it's good.
Thank you. That's enough answer for me. Now I get it. I get the way it's going. Thank you.
You're welcome.
Visit your physician for further advice. You need to be checked on before further advice. Thank you so much, Doc. Okay, at this point in time, Rotary Time, may I call on Lion Gifty Board from the Magenta Women give us the vote of thanks.
Thank you very much. So we'd like to thank the speaker, Dr. Kwesi Amissah-Arthur, for making time to educate us this evening. I also like to thank all Lions and Rotarians who joined us. I hope we all have picked up a few words of wisdom from what Doc spoke to us about. And to our guests, we also say thank you. We hope the knowledge we have impacted onto you this day will be used to live healthier lives. And we should all take this thoughts into our minds. As Doc said, look after your general health well. Try your best not to get diabetes. And if you do get diabetes, manage it very well. Thank you very much to everyone for coming this evening. Over to you.
Thank you so much. Yes, Leon Gifty. We'll try and get here. Are you there? Okay, so PAG Ajo says very educative presentation. Thank you so much, PAG Ajo. PAG Ajo, we met at AEO. Are you also back in Accra?
Yeah, so I was surprised to see you, and good evening. I'm back home. Thank you.
Great, thank you. We'll try and get here. Are you there? Please,
yeah, I'm here, RP.
Hey.
Hey. Happy. Before we go, I think there's a hand up from QB Flix. I don't know if you want to.
Okay, kindly introduce yourself and then speak. Of course, maybe this will be the last one. Kindly introduce yourself and speak. Oh, that was okay. I think we'll proceed. So, Lieutenant Getia, are you with us?
Yes, I'm with you.
Yes, so Lieutenant Getia, please. Do we have any other Getty? Lieutenant Getia, your response as Getty. Are you also Getty?
No, there is a gentleman responding at the background.
Yeah, that's Lieutenant Getia, but he's not Getty. Anyway, so I'm talking about Lieutenant Getia. I know it's not Getty. It's not Lieutenant Getia. It's Lieutenant Gertrude. So
okay.
We have two Gertrudes. We have PH Gertrude, and then we have Lieutenant Gertrude of Rotary Club of Accra-Spintex. So Lieutenant Gertrude of Rotary Club of Accra-Spintex. Can you please help us with attendance?
Thank you, Chairman President. Fellow Rotarians, guests, Lions, Leos, Retractors. We have 8 members for today, representing 28%. We have 16 visiting Rotarians in the presence of PAG Shika, Accra South, Rotarian Dr. Kwesi, our speaker, Accra East, B. Eram, Accra Teshinongwa, RP Vic, Accra Teshinongwa, Rotarian Mercy, Accra East, Rotarian Nketia, Accra Teshinongwa, Rotarian Lucy, Accra Teshinongwa, Rotarian Samuel, Accra Industrial, Rotarian Vida, Accra Teshinongwa, AG Kofi Renchi, Accra East, Rotarian MFA, Accra Teshinongwa, Rotarian Melvin, Accra East, BAG Ajo, Accra East, PP Nat, Accra Tesano, IPP Niram, Accra West, Rotarian John O, Accra East. We have 14 Lions in the presence of Lion Alberta, Tema Gentle Women's, Lion Letitia, Tema Gentle Women's, Lion CP Abraham, Tema Industrial, Lion Dede, Tema Gentle Women, Lion Edwin, Lion KOB, Tema Greenwich, Lion Mami Araba, Tema Gentle Women, Lion Nana Boatima, Tema Gentle Women, Lion Patience, Tema Gentle Women, Lion Ruby, Accra Jinyami DC, Lion Sunshine, Tema Industrial, Lion Eno, Tema Gentle Women, Lion Dr. Helena, Lion Derek, Tema Industrial. We have 4 visiting retractors from Regional Maritime University in the presence of RP Eli, IPP Kweku, Retractor Joseph, Retractor Florence. We have 2 Leos in the presence of Leo Seram and Leo Schroeder. We have 25 guests in the presence of Edward Odonko, Emily, Amissah-Arthur, Sharon Frimpong, Sharon Boko, Solomon Entry, Veronica, Winifred, Efiba, Alberta, Bright Obin, Ginateria, Harriet, Abdul Razak, Jonathan Agambire, Techno POP3, Hope 7 Mate, Palmas Choklo, Na Dede, Edem Perpetua, Marazi D, Seraphine Gidisu, Cube Flex, and 202003. Thank you, Rotarian President. That will be all for attendance.
Thank you so much, Rotarian Getty. We are very grateful. For also announcement, PP Sewa, are you there? Any announcements from our side? PP Sewa.
John President.
Yes, sir.
While PP Sewa is preparing to do the announcement, can I please take the...
Hello?
Okay.
Yes, Mr.
I don't have any announcement.
Yes, PLE.
Okay, thank you, Chairman President. Next week, we are supposed to have our Kinky Fest fundraiser. And so the admin committee is working on the plans and the flyer will be out soon. And so the club and our guests will be informed about that event later. Thank you.
Okay, thank you so much. So, Lion President, Mami Araba, any announcements from your side?
Yes, please. Lions, this Wednesday on the 9th, we have DJ visiting the Tama Club. So Tama Industrial, Tama Gentlewomen, Tama Greenwich, DJ will be visiting us on the 9th, which is 6 p.m. And then the Atta is District Cloth. And Tama Industrial, Tama Gentlewomen, on the 20th too, we have zone chairs visits on the 20th of which is third Sunday of this month. So basically that is the announcement so far. Thank you.
Thank you. Thank you, Lion President.
Thank you.
Return Ohiniba, are you with us? From Accra, Tishanungwa. Return Ohiniba.
Hello.
RPLE of Regional Maritime University. Any announcement from your side? RPLE, RMU. All right, okay. Well, so fellow Rotarians, Lions, retractors and guests, Rotary time. Well, thank you all so much for joining us today in this wonderful joint meeting. May I call on CP Shika to depart us?
Thank you very much, RP. I hope we all have a drink in front of us and something that will not aggravate diabetes. That's like fellow Rotarians, Rotaractors, Lions, and guests. Please drink with me a toast to Rotary International and to Rotarians, Rotaractors, and Lions, wherever they may be.
Rotarians,
Rotaractors, and Lions,
wherever they may be.
And Dr. Kwesi, thank you so much for a wonderful presentation.
You're welcome, CP. Thank you for having me.
Wish you a wonderful travel